Hello everyone, welcome back to this class, Foundations of Nursing 3. Today I want us to focus on the remaining portion of the respiratory emergencies or respiratory problems that would require emergency intervention. I want us to start off with hanging and strangulation, of which we are going to look at its definition, how to recognize it, how to restore adequate breathing in a person who has been found in such a situation, and the process of referring such a person to the hospital or to the nearest hospital. Now, when we talk about hanging and strangulation, it's more or less the pressure, or when we talk of hanging in itself, it is more or less a suspension of a body by something around the neck, something that is tied around the neck. Strangulation now comes in when that which is suspending the body is squeezing or constricting around the neck or the throat. And as we all know, when that happens, there we will have occlusion of the airway and insufficient oxygen intake and release of carbon dioxide, which will interfere with the metabolism within cells, and eventually the area will become toxic to cells, and the cells will die, then the organ system, and then the organism. So that means prompt care or management is very important. So how do we recognize hanging and strangulation? When a person has a constricting article around the neck, if someone has something around the neck that is constricting, or you find a casualty and there are marks around the casualty's neck, and they may present with rapid and difficulty in breathing, and sometimes impaired consciousness. Now the skin would start to form what we call cyanosis, that is the skin turning blue, especially to the light skinned. You'll realize that the skin is turning blue. Now there could be congestion of the face with prominence of veins and tiny red spots, and when you look at the eyes, they could be white, they would look white. That is because of the inadequate blood to the upper part of the body. Now when you find a person who has hanging or strangulation, probably you may find this person who is still hanging, or they were hanging and they have been brought down, or someone was trying to strangulate that person. So generally, you as a first aider, your main aim is to restore adequate breathing, and another aim is to urgently remove that which is strangulating the casualty, and to urgently find a way of taking that particular person to the hospital. Now, how do you restore adequate breathing? The first thing you do is to remove any constriction around the casualty's neck. If you find the casualty hanging with a rope around the neck, then you help the person from the hanging position and loosen that which is around the neck. Now, if the casualty is hanging, as you try to relieve the constriction, you also try to support the body so that by the time you are relieving the constriction, the body is supported, so the pressure or the constriction that comes with hanging is reduced. Now, at the back of your mind, you should know that the body will behave, because probably you found this person if he is still unconscious. So the body will be very heavy. So you should have that at the back of your mind. Now, if the patient is conscious, you should help them to lie down. And when you're doing that, you try to support the head and the neck. And you should be able to call emergency care for help. Even when you feel that the patient appears to recover fully, there is need for monitoring. So the emergency care will be prompt in doing that. Now, the person may need monitoring and recording of vitals and the response as time passes, responses, breathing and pulse. So that one, you will be monitoring the pulse, the breathing, the respirations until the emergency help arrives. Now, usually, it is important for you to remember that you should not move the casualty unnecessarily, especially if you suspect that there is already spinal injury. And when you remove that which is causing the constriction, don't destroy it or try to interfere with it, because that is a case that may involve the police. So there is need for evidence of that strangulation. So that which you remove that was constricting the airway should be kept safe, just in case evidence is needed. And if the casualty is unconscious, make sure to open the airway and check for breathing. That is, if you find the strangulated person already unconscious, you make sure you check the airway and you ascertain the breathing. Now, apart from that, again in the respiratory system, we have inhalation of fumes, which also affects the respiratory system and can cause blockage. In this, a person can inhale smoke, carbon dioxide, carbon monoxide. Someone can inhale solvents or fuels. So in such a case, how do we restore adequate breathing, and how do we move the casualty to the hospital setup? So basically, when we talk about smoke inhalation, we should remember that this usually is very, depending on what has been inhaled, can be very lethal. So what is usually affected is the oxygen level in the blood tissues, and that definitely leads us to hypoxia. We had talked about hypoxia before, and you know the damages that can happen when there is hypoxia. So for that reason, there is need for immediate medical attention. And if you assess the environment and find that rescuing the patient is likely to put your life at risk, then you do not attempt at all to carry out the rescue. Now, an example is where the fumes are in the air and there's someone who needs your rescue. Your life is in danger because you will equally inhale such fumes. So you focus on safety before you start rescuing. Now, if anyone is not wearing protective gears like the face mask and the fumes are in the air, definitely they will inhale and they may be casualties themselves. That is why we say if your life is in danger, then you cannot rescue. If there is a risk that you will inhale the same fumes, then you do not risk carrying out the rescue operation. Now, I want us to start by looking at smoke inhalation. Smoke inhalation usually probably may occur when a person is enclosed in a room where there is fire outbreak. Now, if anybody comes in as a casualty of a fire outbreak, one assumption that must always be there is that they inhaled smoke, which can be from burning plastics, foams, synthetic wall coverings. All when they're burning contain fumes. Now, casualties who have suffered this kind of inhalation should be well examined for other injuries due to fire, such as external burns. If it was because of fire, then there's a probability that even the external body is involved. But remember, we try to remember that you may not see the injuries caused by inhalation, but you already know what happens, the physiology, the pathophysiology when smoke is inhaled or any other fumes are inhaled. When we talk of carbon monoxide, which is a poisonous gas, and usually it is produced by a burning charcoal. It does not smell and you cannot taste it. So usually the carbon monoxide goes direct to red blood cells, and when they attach to the red blood cells, it means they compete with the oxygen carrying capacity, or they reduce the oxygen carrying capacity of the red blood cells, and therefore the tissues do not get adequate oxygenation. Now, generally, all these inhaled fumes, carbon monoxide, smoke, are very fatal, and the more the exposure, the higher the chances of injuries. Now, when we look at the effects of various fumes of inhalation, let's say carbon monoxide. Carbon monoxide can be found from exhaust from motor vehicles, from fire, burning fire, from emissions from gas, burning charcoal, all that. The one that is most common is the burning charcoal in our setting. So generally, when there is carbon monoxide poisoning, there's some of the manifestation a patient may have is headache, confusion, aggression, nausea, vomiting, and sometimes incontinence, especially when there is a prolonged exposure. But when there is a brief exposure, you will see the cyanosis on the skin, the bluish discoloration. You can see the patient struggling to breathe, and that is by breathing fast to help compensate the oxygen that is lacking in the body. And sometimes the patient may have impaired consciousness, and later that may lead to unconsciousness. If it is smoke in a fire outbreak, the smoke inhalation can be fatal. It can be fatal more than the fire itself. So it is very important to know that if there is a fire outbreak, one thing you must not assume is smoke inhalation. Now, it usually contains toxic fumes from the burning materials. Now, what it does is it makes the patient present with rapid, noisy, and difficult breathing, that is wheezing, because of the edema formation on the airway and the narrowing generally of the airway. It also presents with burning in the nose and the mouth, and there can be soot, the black discoloration around the mouth and around the nose. The casualty may be unconscious. If we talk of carbon dioxide poisoning, it tends to accumulate and become dangerously concentrated in deep enclosed spaces such as the coal pits, wells, and underground tanks. So when someone has carbon dioxide poisoning, they may present with breathlessness, headache, confusion, and unconsciousness. When we talk about solvents and fuels, things like glue, things like cleaning fluids, lighter fuels, things like gas, things like propane or paraffin fueled stoves, all these can be cause for emergencies. Now, when a person inhales these, the presentation would be headache and vomiting. They can have impaired consciousness. They may have airway obstruction from using plastic bag or from choking or vomiting, which may result in death. Now, solvents, when they are abused, can be potential for cause of cardiac arrest. So it is important for us to be careful about such kind of exposures. Now, when there is inhalation of fumes, the main aim of the first aider is to restore adequate breathing and then transfer the casualty to the nearest hospital. That is through calling the emergency team to get emergency help, attention, even as they ferry the casualty to the nearest hospital. Now, it should when the inhalation fumes involves someone, a casualty in the garage with vehicle exhaust fumes, it is important to open the doors wide and let the gas escape before you enter. You are trying to look out for your safety so that you don't inhale the same. Now, if the casualty is found unconscious, it is important to open the airway and check for breathing. It is important to open the airway and check for breathing. Remember, in this case, the focus is airway. So in this case, the approach is airway, breathing, and circulation, because the main problem is not of cardiac origin but of respiratory origin. Now, the first thing you do when you get someone who has inhalation or fume injuries is to call emergency help. And it is important to let the ambulance team or the emergency team to know that what you suspect is fume inhalation, because they know how it is important to promptly react to that. Secondly, if it is necessary, if you think you're in danger, you should escape from the source of the fume so that you yourself don't become a casualty. And it is important that you escape from the fumes and at the same time assist the casualty away from the fume to fresh air so that they don't continue taking in the fumes. If it is an enclosed area, you should not try to enter into a room which is fume filled. Remember, I said you first open the door windows to allow for air or for the fumes to get away. Now, when you get the casualty away from the fumes, you encourage them to breathe normally. If it is in case of burning and the casualty's clothes are still burning, you extinguish the flames and you treat any obvious burns on the skin. And you should stay with the casualty until help arrives. As you continue to monitor breathing, airway, you continue to monitor how the patient breathes, the pulse of the patient, and the patency of the airway. Now, when the emergency team arrives, of course, you hand over to them and they can transfer the client, depending on the assessment and on what they can manage to do, to the nearest facility. Now, another problem of the respiratory the respiratory system that may need emergency care is drowning. When we talk about drowning, it is important that you note that in drowning, your main aim as a first aider is to restore adequate breathing, to keep the casualty warm, and to arrange urgent transfer or referral to the hospital. You arrange how the patient can immediately reach the hospital for further or for advanced care. Now, when we talk about drowning, basically we need to get to understand what drowning really is. And in case of drowning, how do we restore adequate breathing? How are you going to provide warmth to a patient involved in drowning? And how do you take the patient to the hospital setup? Now, for advanced care. Now, drowning is very vital, and one thing that can cause death from drowning is hypothermia, which is low body temperatures. This happens as a result of immersion in cold water, and sudden cardiac arrest can occur due to the cold water, spasms of the throat, blocking of the airway, and inhalation of water, and consequent airway obstruction. So when you look at this, you find that when the body is immersed in cold water, the body becomes cold. In the process, the person is also probably ingesting this water, and all these events may lead to cardiac arrest. Now, when there are spasms of the throat, the airway narrows, and at the same time, some of the fluids, the water is aspirated into the airway. That covers the alveolar surfaces where gaseous exchange may take place, causing obstruction, and this is very fatal to the casualty. Now, a casualty who has been saved from drowning must seek medical attention, even if they seem to have recovered at that time, because any water that enters the lungs may cause them to become irritated, and the airway will be irritated, and then the response of the airway to the irritation could include things like spasms, bronchospasms, and there could be swelling several hours later. This swelling may occlude the airway, and it may also, the treatment of hypothermia may also be needed in that case. So generally, that is called secondary drowning. The first one is the immersion in water, but then later there is the edema formation in the airway, and then vasospasms and such. That is called secondary drowning, and that may be fatal too. So as a first aider, you should ensure that if the casualty is unconscious, then the airway is open, and you check the breathing. Remember, as I reminded you earlier, this is still in the respiratory system. So in this case, the casualty's main need is in the respiratory system. So the focus or the approach is still ABC, that is airway, breathing, and circulation. So you ensure the casualty, you have to ensure that there is airway, the airway is open, and there is breathing. And in case the casualty is not breathing, you give 5 initial rescue breaths before you do chest compression. So in airway, breathing, and circulation, the problems that affect the airway, you always start with the 5 rescue breaths then you go to chest compressions. In the other way, you start with, if it is of cardiac origin, you start with the compressions, then you go to airway and breathing. But in this case, because the focus is the respiratory system, you start with giving 5 rescue breaths, then you start the chest compressions. Now, usually you are encouraged to give the compressions only if you have formal CPR training. And when a person is unwilling to give rescue breaths, that is the time that they may focus on giving the CPRs too. Now, this is done until the ambulance team arrives, and then they dispatch the casualty to the hospital. The casualty needs to reach the hospital setup as soon as possible. Now, our main challenge here that we should not forget to focus on is hypothermia, and then the unconscious casualty. Now, when you have a person who is drowning, first, the person needs to be rescued if he is still in a state of drowning. That is to be removed from the water. You help the casualty lie down, and the head should be lower than the rest of the body, so that it could be easier to remove water from the mouth. It can be easier for the water to drain out of the mouth. Now, this will reduce the chances of inhalation or aspiration of the water. Now, again, the next thing is to treat the casualty for hypothermia. If there's anything warm around, you cover the casualty with it. So actually you remove the wet clothing from the casualty and use dry clothing to cover the casualty. If there's a blanket, if there are coats, use that to cover the casualty. If the casualty is fully conscious, give him something warm to drink. You can give him something warm to drink. Now, when you do that, you also call the emergency team for help. And as you wait for the emergency team for help, you monitor the casualty for risk of secondary drowning. Remember what we said secondary drowning is. Now, you also, in the process of monitoring the vital signs, you would be able to monitor the secondary drowning even as you wait for the emergency help to arrive. Now, another challenge or problem of the respiratory system that may need immediate care or emergency care is hyperventilation. Hyperventilation is usually usually manifested as an anxiety attack or acute anxiety. How does someone manifest anxiety? So how would you recognize that a person has hyperventilation? If someone has anxiety, how would you recognize that? First, this person will be very irritable and they will be breathing very fast. If you feel their pulse rate, it will be very fast. It will be more than what is within the normal range. Then they have apprehension, the fear of not knowing what is going to happen next. They are apprehensive. Now, they may also exhibit attention-seeking behavior. They may faint. Because of that anxiety, they may end up fainting. When you look at their palms, because of the anxiety, they may have, they may be trembling, they may have sweaty hands, their mouth may be dry, they may feel tingling in their hands, they may feel tingling and cramps in the hands and feet and around the mouth just because of that anxiety. And in this case, your aim as a first aider is to remove the casualty from what causes the anxiety and reassure the casualty to calm down. The main aim here is to help the casualty calm down. Now, there is always that which triggers that anxiety, and if it is you're able to identify it, it is important to remove it from the casualty. Now, be very cautious not to advise the casualty to rebreathe her own air from a paper bag, since that can complicate issues. This kind of problem is rare in children. So, as in hyperventilation because of anxiety is uncommon in children. This anxiety, hyperventilation because of anxiety is majorly common in adults. For children, if they have hyperventilation, it is important to identify other causes. So when a person present with hyperventilation, it is important that when you're speaking to the casualty, you be firm but kind and reassuring. You don't show them that you also don't have control, because already they don't have control. That is why they are anxious. So when they look at you and your body language speaks control and what you speak is control, then that firmness helps to be kind of reassuring. And if it is possible, you should move the casualty or lead the casualty to a place that is quiet, where she or he may be able to regain the control easily and quickly. Now, if this is not possible, then it is important to ask the bystanders to leave. Sometimes more people causes more anxiety. So if there are many people, you disperse them, you ask them to leave so that the casualty may find a more quiet place to rest. Now, secondly, you should encourage the casualties to seek medical advice on preventing and controlling panic attacks in the future. So we have people who have panic attacks, and of course they know because it is a disorder that maybe is recurring. So you advise them, you ask them about what usually makes them have the panic attacks, and ask them to avoid the situations or scenarios that makes them have panic attacks. Now, another respiratory emergency that we may want to talk about is this disorder called croup. This usually is among the children, and it is important to be able to assist such children who come with croup. Now, croup is basically an attack of breathing difficulty in young children, and usually it is caused by inflammation of the windpipe and the larynx. It can be alarming, however it passes out without a lasting harm in most cases. And most of the time you find that this kind of attack happens at night, and if the child develops anxiety or cries, then it worsens the situation. So your focus should be to maintain that calmness in the child who may have this kind of attacks. If the attack persists or it becomes severe and it is accompanied by fever, it is important to call for emergency help. And For you to recognize croup in a child, you will see a depressed breathing in a child, short and barking cough from the child. There could be rasping noise, especially on breathing in. That is what we call the stridor. There could be croaky voice. There could be cyanosis. And when it is severe, the child may use the accessory muscles when they are trying to breathe. Sometimes a child may be having epiglottitis, and that is also an emergency case, and differentiating it from croup may not be easy, but you can suspect epiglottitis if a child is in respiratory distress and is not improving, and if a child has high temperatures. That is why we say if you think it is croup and there is persistence, it is not relieved easily, and the child is developing high temperatures, then you could be querying epiglottitis, which is dangerous, and it is important for the child to seek medical attention as fast as possible. Now, your main aim here is to comfort and support the child if it is croup, and to obtain medical help if it is necessary, especially when you query epiglottitis. Don't try and put your fingers down the child's throat, thinking that you are sweeping off or opening the airway. That will only increase muscle spasms, which in the long run will end up blocking the airway. Now, first, in managing such a child, you need to sit your child on the knee, support her back, calmly reassure the child. Try not to panic, since this will also alarm the child. You need to be in control. That is what that means. And that will try to ease the attack. If it is safe to do so, create a steamy atmosphere, because that will help relax the airway. This can be done by taking the child into a bathroom and running hot tap water on a shower, or going into the kitchen and boiling some water and keep the child clear of hot running steam. Now, basically, previously in the native African communities, there was boiling of water and then covering. Steaming was done by boiling of water and covering the children, or the people who wanted to steam, with a blanket around that blanket, as the steam comes from the pot, so they inhale. Thirdly, you need to call for medical help if the croup is severe, because remember we said it could be a case of epiglottitis. And as you wait for this, the emergency help, you monitor the vital signs, the breathing, the pulse. You look at the response out of what you have been doing to the child as remedy. You look at the response of the child, even as you wait for the help. Now, one more of the problems that we look at, we would also look at penetrating chest wounds. Penetrating chest wounds, of course, we want to know how to manage the penetrating chest wounds, and for you to manage, you must have recognized that it is present. So when we talk about penetrating chest wounds, we should think about the anatomy of the chest. What do we have in the chest? We have the heart, we have the lungs, we have major blood vessels that lie in the chest. We know we have the breastbone protecting the 12 ribs that make up the rib cage that protect the underlying organs. And also within the chest, we have the liver portion, we have spleen, which is in the upper part of abdomen. Now, when sharp objects penetrate the chest wall, they may damage these organs that are underlying, and the bleeding, particularly from these organs, makes a person susceptible to shock, hypovolemic shock. Now, for the lungs may get damaged, and sometimes a stab into the pleural space allows the air to penetrate the pleural cavity, and that would exert pressure on the lungs, and the lungs may collapse, a condition that may be called pneumothorax. Now, for you to recognize a penetrating chest wound, one, the patient will be exhibiting painful and difficulty in breathing, usually shallow and rapid and uneven. Shallow because as they breathe deep, they feel more pain, so they maintain it shallow, but the body requires oxygen, so it is rapid to compensate. Now, they may feel a sense of alarm. The casualty may feel a sense of alarm, and this may also lead to hypoxia. Of course, when you're assessing hypoxia, you know things like cyanosis. You'll be able to observe if they are coughing, because of the chest injury. If the lung is involved, there could be frothy red blood that is coughed up. There could be crackling feeling of the skin around the site of the wound. That is because of the air that is collected in the tissues. There could be blood bubbling out of the wound. There could be sounds of air being sucked into the chest as the casualty breathes in, and the veins in the neck may become prominent. Now, usually the aim of a first aider in this case is to seal the wound and maintain breathing, minimize shock, and arrange urgent movement to the hospital or referral to the hospital. So when you find such a case, first you should help the casualty to sit down, and you can encourage the casualty to lean towards the injured side and cover the wound with the palm of his hand. Next, if it is possible, make sure you place a sterile dressing. Next, you make sure you place a sterile dressing on the clean or a clean and fluffy pad. Maybe you might not have a dressing, so some clothing or rag that is clean should be placed over the wound and around the area, and then covered with a plastic bag of oil or kitchen film. Now, it should be secured firmly with an adhesive tape so that the dressing does not fall off. Now, generally, after doing all this, you need to call emergency help, and as you wait for the emergency help, you continue to monitor and to support the casualty, in the same position for as long as he remains conscious. But during this time, you also monitor vital signs and the level of response of the casualty. You want to make sure the casualty stays conscious for as long as possible, or until the emergency team arrives. And if the casualty is unconscious, it is important to open the airway and check breathing. And if you need to place a breathing casualty, you may need, if the casualty is breathing well, you may need to place the breathing casualty in a recovery position. And basically, you can roll him to the injured side to help the healthy lung to work effectively. Because if one lung is already involved in the accident, the other one can be use to maximize the function that is required. Now, the next problems that we're going to look at are going to be the circulatory problems, which we will look at in our next recording. Now, next week we will have a practical session, and I want all of you to prepare and brace yourself for the practical session that we will have next week. Now, make sure to go back to the reference. Make sure you go back to the references that are listed to get to know more about the conditions that we have discussed so far. Otherwise, thank you.